Hey besties, welcome back to another episode of The Nurse Aspect where we assess and evaluate. My name is Nurse Becca and today we have on the show Nurse Sara.
Hello.
What's up, girl?
How are you?
I'm good, how are you?
I'm good.
You look so good.
Thank you.
So tell me, why'd you get into nursing?
Okay, so long story. So let's start out with I had a rare autoimmune disease attack my brainstem. It happened out of nowhere. I remember just sitting in Italian class, taking my test, and I just felt like off. I was pale, I had cold sweats. I got sent to the nurse's office. My mom picked me up, took me to the doctor. They were like, oh, it's just a stomach bug, don't worry about it, it's going around. We thought nothing of it, we're like, okay, whatever. A couple of days later, I woke up one day and I wasn't able to swallow. My mom made me my favorite sandwich, cut it up in small pieces, and I wasn't able to swallow that. So then we were concerned. So we called the neurologist. They said send her to the emergency room right away. And ever since that day I was sent, I was in the hospital for 4 months. And
That's crazy.
No one had any idea what was going on with me. They would do test after test. Everything would come back negative. Negative. And it was just like stumping everyone. But every day I would progressively get worse to the point where I ended up in the ICU, intubated on a ventilator for a couple of days. So yeah, no one had any idea what was going on. And I would get treatment after treatment. It was something called IVIG. And that would only help me for about a month, and then I would relapse with the same symptom. I lost my ability to swallow, couldn't go to the bathroom on my own, saw double. So I ended up with a feeding tube, and we thought that was going to be the rest of my life. I thought I would have to go home with that.
Mm-hmm.
And prior to this, I was completely healthy, premier soccer player. In high school, getting ready to get recruited to go play soccer in college, because that was my main goal until this happened. So one day I was in the hospital and I said to my dad, I was like, can I just try to swallow that? It was mashed potatoes or something, and I tried and I did it. And we all looked at each other, we're like, did that just happen? Did you actually just swallow something? And I was like, I think so. So we tried it again, and we all were crazy, what just happened?
Y'all doing the feast test on you?
Literally, we're like, did this
If I was a nurse, I would have been hot. If something happened to you, I would have been hot. Not gonna lie.
So yeah. But prior to that, I had a spinal tap done, and they sent the fluid to Barcelona, Spain, where they tested non-commercial antibodies, and it came back with a rare antibody that attacked my brainstem. To this day, they have no idea how it happened, why it happened. I got genetic testing done, everything came back clear, nothing, no history of anything. So practically that's why I chose to go into nursing, because I saw the care that all the nurses gave to me, and I wanted to be able to give back to others, because I know how it felt to be bedridden and just feel lost and hopeless and helpless and not be able to care for yourself. So, yeah.
That's a incredible journey. That's crazy that something like that pushed you into going into nursing. Were you at the time, prior to this happening, did you think that you were going into a different field? What
Yeah,
were you thinking?
I don't even think I thought of nursing or thought I could do it. I always wanted to do something with science, but I was mainly going towards forensic science.
Mm-hmm.
I was just gonna go for it and give it a try. I really had no idea. Honestly, my main focus was soccer, because that's what I just grew up doing, and I thought I was gonna go to a D2 school and I'll figure out the rest. Just go for soccer and something will come from it.
Mm-hmm.
But then this happened, so I picked nursing.
Okay. Well, we're glad to have you, girl.
Thanks.
Where did you start when you what was your first nursing job?
So my first nursing job was in a nursing home. I started out as like, it's called like pushing the med cart, like as
Girl, I've been there.
as like an LPN would do. I did that for a couple of months. I was trying to milk it because in the nursing home, once you have like your RN license, you're considered a nurse manager. And that's not something like I wanted to do or saw myself doing coming straight out of nursing school. So unfortunately when COVID hit, that's where they needed me, so I had to do that. And then lucky enough, I found a job at the hospital. And my first job in the hospital was on a tele floor. That's where I met you.
Hey, girl. What up?
And it was great. I definitely learned a lot. It was definitely different from a nursing home, as you know.
For sure. Yep. As I do know.
So then after that, about like, was it a year and a half, I got a job in a ICU, a SICU, which I absolutely love now. And I'm actually happy I started on the floor. Not that it's like necessary to start on the floor, but I definitely thought it helped and made the transition into an ICU a little bit easier.
How do you feel like it helped you?
Because like, you know, like the basics, what to look for, kind of. When you're in the ICU, you're just like digging in just a little bit deeper because you have two patients who are super, super sick. But like, I feel like having the basics from the floor, how to hang IVs, what medications are for, and just like what to look for, how to do an assessment, like it just made it a little bit easier. Obviously, when you go into the ICU, you have a ton of new things you have to learn. But just having those like basics made it a little bit easier, if that makes sense.
Is there like anything you loved about tele or hated about tele, or both?
I loved like how different everything was. Like cardiac, something can happen at any moment. Like I felt like I learned something new almost every day. Probably something I didn't like was maybe the patient ratio.
Yeah.
Especially.
No one
I feel
likes
like on med surge floors,
unless if you're like in Cali, no one likes the patient ratio.
It just got too much.
Yeah.
Too many patients for one little nurse.
Girl, I'm not gonna lie, I don't miss that part either. Yeah.
I don't know how I did it. I look back and I'm like, did I really do that?
Yeah. I feel like one of the things that is great about med surge, tele, med surge, whatever, is just like you do learn a lot. I feel like it gives you a good foundation in terms of like how to take care of a patient, how to talk to a patient. I feel like it's great if you never worked in like as a PCA or something like that. It's a great stepping stone. I feel like a lot of people don't think that that's where you should start. You should probably start in your specialty or whatever. And I know things change. Like nowadays, like people can start right onto their specialty without having to do med surg, which is great. But like I said, I think it does give you a good foundation, how to manage patients, manage families, manage like all these other like specialties that come into play. A lot of times, like we would definitely get those types of patients that like, all right, you're on tele for nonsense. Like you really are a psych patient.
Yeah,
and you're
all the time.
on tele or whatever. So like managing just other diagnoses is like,
I feel like we definitely saw like a lot.
A range.
Like
the range was wide.
Regardless if we were like a tele floor, whatever, like we saw everything, which I think also prepared me well because going from a cardiac floor to like a surgery floor was obviously really different, but I did feel a little bit more comfortable because of having that background and seeing everything.
Yeah.
You know?
What do you love about the SICU?
About the unit, I love the teamwork we have. Anytime you get an admission, everyone runs in to help you regardless. God forbid of an emergency, everyone's there to help you. We all work as a team. But I do like the patient population. I do like the acuity. We are also a trauma center, so we do get to see like cool traumas. And I just like doing like the MTPs, the massive transfusion protocols, like seeing the different surgeries, dealing with like the pressors and like titrating and just like seeing you like make a difference in like the patient's outcome.
In the ICU, I know like it's like I feel like working in the ICU is more of an autonomous kind of role. Do you find that to be true?
Yes. And it was definitely a hard adjustment, like learning to just learning to like trust yourself and like your gut, because I felt like on the floor we were always like calling the provider for like every little thing, and here or in the where I work, like you can still do that, but they expect you to like just know certain things and just do certain things as an ICU nurse. And especially with the pressors, when I first had to learn that, I was petrified of like titrating up or down depending on their blood pressure, because like I had so much control over their blood pressure with like such a serious medication, and I was just so nervous. But you get the hang of it, and like now it's just like 1, 2, 3 works.
How long do you feel like it took you to like feel comfortable in the ICU?
Definitely maybe like a year.
Okay.
I think.
All right.
Yeah.
What's one of the coolest things you've seen in SICU?
Oh man.
You can narrow it down.
Let's see. I guess I can talk about like cool devices maybe.
Okay.
We have we do our own dialysis. It's not like HD.
Okay.
Ours is CRRT, continuous renal replacement therapy, which is over 24 hours. It's super slow. And obviously coming from the floor, we don't manage dialysis at all. We have like a dialysis nurse come.
Right.
And being able to like do your own dialysis for your patient, I think that's like super cool.
Okay.
And it's like a 1-to-1 ratio, because that you need to be in there like every hour, every like 30 minutes, depending on like the flow of certain things, and like changing the bags, checking the monitor, checking the patient, checking their site, like things like that.
Okay.
Yeah.
Is there anything you don't like about SICU?
Definitely like, I guess like some of the patients' endings, because they're all obviously all not happy endings. And sometimes just seeing them come in like talking A04, and then like within seconds, a couple of days, they're intubated, not talking to you, sedated, and like slowly or quickly are declining and don't have a good outcome, which is pretty sad.
Yeah. It's always tough, like losing a patient and not having a good outcome. That's definitely rough. It is a part of life, part of nursing. But yeah. Not fun.
Sometimes you get like super like close with the patient or their family.
Yeah.
And you obviously try everything in your power for those 12 hours, like save the patient, but sometimes the outcome is not the best.
Yeah. Do you see yourself doing anything else?
Eventually, I'm either leaning towards like NP or maybe nurse educator. But first I do want to get like certified in critical care, take my CCRN. And then we'll go from there.
When you, does it, like on the floor that you're on, I know every hospital has like their own protocol and stuff like that, but how long does it take for you to be eligible to take CCRN?
I think you have to do like a certain amount of hours. I don't think it's like hospital like policy.
Oh, okay.
I think it's just like the CCRN like board themselves. They have certain like qualifications that you have to meet. And I think you just have to meet, I don't know the exact amount of hours, but you have to meet a certain amount of hours to be actually like eligible to take the exam.
Would you ever consider like getting your CCRN to become a CRNA? Like why NP or educator?
I thought about it. I definitely didn't like kick it out of my plans like altogether, but it's just the whole fact that kind of like you have to go to school, you can't really work. Like, how am I gonna make that work? I feel like it's kind of hard with money and everything now.
Yeah.
But yeah, I don't know.
I mean, that definitely is a sucky part. I know, I do have like a friend that is like, you know, trying to get into, to become a CRNA. And like, I remember like her talking about the process and I'm like, I don't know how people do it, like to not work, like, pardon? Because I have bills. Like, what's going on here? That's crazy.
Yeah.
You want me to not work? And are
to
you
drown.
paying for my bills? And like school's not cheap. Like
No.
exactly how much loans would I even have to take out to even cover everything for the next like 3 years of your life is like
Yeah.
it's crazy. Like yeah, you do make money, afterwards, but that is still that's nerve wracking.
Definitely.
Y'all need to come up with a different option, okay? Like okay, y'all gotta come up with a different option. That's
For
crazy.
real. So, yeah.
Mythbuster. I just clear it up for us since you work in the ICU. ICU nurses are notorious for like meticulous bed making and like
Yep.
the sheets gotta be mitered.
Yep.
What are y'all doing? Because the sheets, if I'm not gonna say I'm gonna throw the blanket over you like in the ED if you're lucky if you have a sheet, but
No.
okay, if the sheet's not mitered, what's gonna happen exactly?
The nurse coming in is gonna fix it.
No, I understand that, but what's your problem?
Oh, we just like everything to fit perfectly.
I'm not annoying with that.
No, we fold it a specific way, laid on the patient. It can't be opened all the way.
Why?
I don't know. It's just how neat we are. I have all my lines running through like a little holder at the top of the bed. Everything. There are tele lines going through their gown a certain way.
I mean, I do like that. Don't get me wrong. I'm like, for y'all, I'm not sloppy. I am not a sloppy nurse. I actually don't like just as a labor and delivery nurse, I hate when I go into a room and it's a mess. The patient could be talking to me. I'm going to be cleaning up this room. I one time, just quick little story time, I literally had a patient's like husband was like, I was cleaning up the room and he's like, damn, that's part of y'all job. And I'm like, no, I just like the room clean.
Yeah.
Like, I'm not going to be talking to you. And it's like, it's a mess. Like there's instruments all over the place and whatever. So I'm not messy by any means. I don't like a mess, and I actually do miter my sheets. Actually, I do. Like just in general when I'm making up my own beds or whatever. But I'm just saying ICU nurses are so damn meticulous. And I just feel like y'all have the time for it. ED nurses, I feel like don't have time for nothing or whatever. And then med-surg nurses just fall somewhere in between. Like,
I mean, sometimes we definitely don't have the time if our patient's obviously crashing and burning.
Yeah.
But when we do, we don't like our lines crossing over the patient. We'll have 2 pulls on each side. We don't care. All of our
y'all
lines.
got poles. Like, see, that's the thing. Y'all got equipment because other places do not have equipment.
Fair. All of our lines are dated and labeled. Obviously, that the labeling is important because God forbid an emergency, you need to know where is what.
Yeah.
But also, it's just nice and neat and pretty.
Whatever. IC nurses have the time for it.
Sometimes.
All right, y'all don't be always have the time because I promise you it don't work like that everywhere else, especially when you go to the ED. Got time for that.
No doubt.
Yeah,
It's a
revolving
different
door,
animal.
and the ED's the bowels of the hospital. Ain't got time for mitering sheets.
Yeah.
One time I had my best friend, which you guys will meet eventually. I one time had him. He told me about he used to work in the ED, and I remember he got in trouble because a patient was asking him for a pillow, and he was like, "A pillow? We got no pillows in the ED. Like we have a stretcher for you, and we could raise your head. That's all we got. I don't even have time for this. I actually have to discharge 4 patients, and I have another 4 coming in. Like I don't have the time for that.
Wow.
But yeah,
Yeah.
I see you. Okay. But in terms of like you said that in terms of NP, like would you consider like FNP acute? Like is there a specific or whatever? You're just not totally sure yet.
I'm not totally sure yet. I would probably lean to like outpatient maybe.
Oh, really?
I don't know. I feel like because when we used to work on the floor, like seeing the MPs that used to take care of our patients plus 3 other floors,
They
that's
work
like
like a dog.
30 different patients,
Ain't got no
and
break.
they're
Phones
like,
ringing all the time for nonsense. Yeah, not nonsense, but
it's
you
like
literally don't have a break.
yeah.
Yeah,
I just don't know if I want that stress.
yeah. I can understand. That's real. That's definitely real.
So, yeah, I don't know yet.
Okay.
Still up in the air.
Do you have a tip that you would want to share with like either your former self or like a fellow ICU nurse, or something that you feel like you needed to know along the way or you should have knew along the way?
I'd say don't ever be afraid to ask questions. I feel like the most dangerous nurse is the nurse that doesn't ask questions.
Were you ever that kind of nurse?
I don't think so. I would just tell myself to man up and just go ask the question. Because at the end of the day, you're reliable, it's your license, and you're there for that patient.
Yeah.
You know what I mean?
Yeah.
You're there to advocate for that patient. Who cares if they think you're stupid? If it's going to help you and answer your question and take care of your patient, and you can go home with a nice, clean mind and go to sleep, whatever.
I feel like you've never been the type of person to back down from anything. I feel like even like when like I remember when I first met you, I was just like, oh, like she's a little quiet girl, like, you know, whatever. You're not that quiet. I feel like you're like a I don't even want to say like a quiet storm. I just feel like you just needed time to get comfortable, like, and just like learning your role and like being comfortable, like learning like the ins and outs of the floor and stuff like that. But you've never been the type of person like afraid to ask a thing.
Nope.
I've never seen you even like ask like a dumb question either. But you're not the type of person to back down to anyone. If anything, you're standing up like, no, I'm not. Are you confused? Because I'm not. Like, that's very much your energy, and I love that. I love that for you. But yeah, I do think that that's a great tip to never like be afraid to ask. I've definitely seen so many nurses literally Google things and stuff like that, and it's just like, why aren't you asking? It's such a danger to.
Yeah, I mean, that's okay, like Googling things, but always ask like a senior nurse, ask the provider, like, I don't care, just do it. I feel like it's so important, because a lot of new grads in the ICU or just in general, like, if they don't ask a question, that's when like you can seriously hurt a patient. You're dealing with serious medications that can like kill a patient instantly, or even on the floor, like doing certain procedures, like, just if you're unsure, just ask. Don't be afraid. Like, it's totally okay.
Yeah.
And even if a provider like shoots you down or makes you feel dumb, just like let it roll off your back. It's easier said than done, obviously, but at the end of the day, like I said, it's your license, and if they're not giving you the answer that you need, you can go to like someone higher, like a charge nurse maybe, manager, or you can also document like a provider contact note type of thing, saying, hey, I said this, and that, I brought it up, no interventions.
Yeah. As per provider.
Yeah, no interventions at this time.
Yep. We'll continue to monitor. Finish it off nicely. Yep. Yeah. Definitely had those kinds of moments. But yeah, true. And I that's another great point too. I think a lot of times like nurses will, especially when you're new, will come in and you'll talk to provider, and some providers will pick up on that fresh blood and like try to make you feel dumb. Sometimes you just gotta take it on the chin and like, okay, like I know better next time, or like this was just a lesson to learn for this time, as you're building up your confidence, as you're building up, you know, how to talk to providers, what to ask and stuff like that. Yeah. I don't think you should be afraid. That's great.
It's definitely, no worries.
Do you have like a story that you would want to share?
So I had a code blue, code ECMO my second week off orientation. Obviously scared.
Yep.
Very
scared. Sounds scary. Did you ever have a code ECMO before?
No. Do I know what ECMO was? 2 weeks off orientation? No.
Did you? All right. So for the girlies out there, so tell real quick, what is ECMO?
So my unit really doesn't deal with ECMO. That's more cardiac. But it's pretty much like a heart and lung machine. It's kind of like breathing and doing everything for you and giving your body a rest to recoup and everything. Okay. From my understanding.
Not from my understanding, but okay. Go ahead, resume your story.
So yeah, my patient came in pretty okay. Some pancreatitis, I think. Went to break, came back, and I went to go assess him, and he was like pretty blue in the face, and I was like, you okay? Do you feel short of breath? He's like, yeah, I feel very short of breath. So right then and there, I like ran to my providers. I was like, hey, I really think you guys need to come to the bedside and assess this patient. I think he may need to be like intubated like right now. So they came, and that's what they did, intubated him ASAP. And then out of nowhere, after like pushing all the intubation meds and everything, he decided to code.
Not decided. Like he made the conscious decision. You know what? Now that I'm intubated, let me go ahead and check on out.
He's like, all right, I'm gonna see you guys later.
He's out to lunch.
His body decided to code. So yeah, that was the first. I remember dealing with that stuff like on the floor. It was never like usually my patient. It was like someone else, and I was like always stepping in to help. But having it as your patient was pretty nerve-wracking at first, especially 2 weeks off orientation in the ICU.
Yeah.
But everyone came in and we all worked as a team. And I learned as being the primary nurse, your role is not to be like running around and doing like tasks that your other coworkers could be doing, like charting or like passing meds. Like your role is, because your patient will most likely be on pressors at that time, like trying to get their blood pressure up or like sedation meds or whatever it is, like is to man the pump and like answer any questions like about your patient. But yeah, so after we were coding him, our provider was like, I think he needs like an ECMO. So we called code ECMO overhead. So the ECMO team came in, did their thing. He ended up becoming like a cardiac ICU patient. But yeah, like all the senior nurses on my floor was like, Sara, this is the first code ECMO we've ever had on this unit.
Wow.
And I was like, you're welcome.
Of course it happened to you.
It's like, yep. So yeah, that's my story.
All right. I mean, well, like, how did you feel like afterwards? I'm sure like in the process, like I'm sure like you were like freaking out.
Yeah.
Or whatever. But like afterwards, in the aftermath, like how did you feel?
I felt like, I don't know, I felt just so, I don't know how to explain it. Nervous. I felt like I didn't do good enough kind of thing. But at the end of like every code, our providers make sure to like debrief and like go over like what could have been done better, how the communication was, like how everyone did in their roles type of thing. And I felt like she gave us all pretty good feedback on like how we worked as a team together and like did everything so quick and like called the code ECMO so quick and like did everything before anything else got like severely worse. You know what I mean?
All right. I mean, what was the patient outcome? Do you know?
Honestly, I don't know because he ended up going to like the CTU unit.
Okay.
So unfortunately, I do not have an update on that.
Okay, that's all right.
But yeah.
All right. Well, I mean, I'm glad that you had that experience. I feel like sometimes things happen to us, and of course, in the moment, you're like, "Why me? Why?" You know, but it does make you a stronger nurse. Like you had that experience, and so like you kind of like know what to look out for next time. And it's you're also right in terms of like, you know, when things happen to like your coworkers and you're like jumping in to help out, totally different ball game versus it's you and your patient. Like this is your patient.
Yeah.
You know, totally different vibe. So yeah, I could relate. Not to the cold ECMO part or you know, but
definitely.
Yeah. All right. Well, thanks for sharing.
Of course.
And thanks for stopping by.
No problem.
You can always come back whenever you like decide like, all right, I think I want to become an MP or whatever. If you want to ever share some coins, you know, I'll gladly accept. I'll create a special fund for that. But thank you so much for coming by, and you're always welcome to like share any part of your journey.
Thank you.
Thanks for tuning in to another episode of The Nurse Aspect, where we assess and evaluate. Quick question, are we connected? The Nurse Aspect podcast is available across all major platforms or wherever you listen to podcasts. If you ever want to be on the show or if you have questions, comments, and concerns, email me at thenurseaspect@gmail.com. Follow me on Instagram at The Nurse Aspect or on TikTok at The Nurse Aspect for nursing nonsense and more. Until next time, nurse on, assess, and evaluate. Omega